Hey everybody, Dr. Jason Saunders with HBOT USA. I'm here today with my good friend, Dr. Ralph DeStephano.
Hello everybody.
So, Dr. Ralph has been working with us in some capacity. How long has it been?
A little over a year now.
A little over a year.
Yeah.
So, he's HBOT USA in Spring Grove, Illinois.
Actually, Chicago. That's the official name.
That's right. So he's our Chicago office and team, and we've been doing this, like he said, for a little over a year, and as far as I'm concerned, I think it's been going pretty well. But I want to talk a little bit today about what Dr. Ralph thinks about that, and also just what kinds of things are we doing, what kind of things does Dr. Ralph do, because even within the world of hyperbaric, each practitioner brings their own personality, they bring their own techniques, they bring their own other services outside of hyperbaric. So, and Dr. Ralph does some really special things in Illinois. So I really wanted to get a minute, get this on video, and kind of share some more of that information with you guys so that you can better understand what's happening over there. So, Dr. Ralph, I'll start. I'll just say that I know that you're a chiropractor.
I am.
I know that you do functional neurology.
I do.
And you've got a really beautiful office in Spring Grove, Illinois.
Thank you.
Another office that I haven't had the chance to see, actually in Chicago proper.
Yes.
And you have a handful of other practitioners and docs, and it's a family business, which is one of those things that really, I get excited about that for me one day, maybe. But so his daughter is currently, and their son.
So yeah, my daughter graduated chiropractic school about a year and change ago. Went through the neurology diplomat program while she was going through school, which was great. So she's a chiropractic neurologist now, so I'm very proud of her.
That's amazing.
And my son just started chiropractic school this past September, and he's going to do the neurological diplomat as well. So simultaneously.
That's
So
beautiful,
yeah, I mean, got to give them credit for
it's a lot to take in.
grad and post-grad work at the same time.
Yeah.
That's just amazing. So
That's great.
Yeah.
So why don't you spend a few minutes, just tell us a little bit more about your practice, the kind of people that you treat, and maybe some of the other modalities that you offer.
Absolutely. So I've been a chiropractor for about 30 years. About 10 years ago, went back to school to do the functional neurology thing, and it was just amazing. And my reason for getting into it, got my own concussion, and called a buddy of mine who was going through the program and said, hey, I think I had a concussion. It's been going on for about 4 days, headache. I whacked my head on a cabinet. And the funny part of the story was I called him up on the phone, and he said, I told him what happened. He goes, okay, we'll do these exercises. And I did them, to be honest with him. It made it worse. I said, whatever you're doing, stop, because you're making it worse. Simply said, now try it this way. Within about a day, headache went away. I'm like, okay, what is this functional neurology, whatever. And he goes, why don't you come to a class? I got a class this weekend. Why don't you come with me and things like that. So went to it, been hooked ever since, and it has totally changed my practice. So today, and 10 years of doing neurology, love chiropractic, but I've kind of transitioned and working with patients now from concussion, stroke, to autism and ADHD, anxiety, depression. It's been great, and I love it.
So can I ask, in addition, and we'll talk about hyperbaric in a moment, but in addition to that, you bring, your chiropractic experience initially.
Yes.
You have this neurology piece on top of that. What other modalities are you offering in the clinic?
Sure. So my office has always been multidisciplinary from day one. We've had medical doctors working with us, like a medical director, physical therapists, massage therapy, started getting into functional medicine as well. So it's kind of very well-rounded wellness type of clinic.
Great.
Yeah.
So, and you've been doing hyperbaric for about a year.
About a year now, yeah.
Do you mind sharing maybe what sort of changes has that brought into your practice for those folks?
Sure.
Maybe wait, two questions.
Sure.
One is, are you seeing maybe some other conditions that you weren't normally seeing?
Yes.
And what addition do you feel like hyperbaric has brought to your clinic?
Yes. Well, first of all, from the addition standpoint, always very important to tell people if you're going to make these changes, they come for a concussion or a stroke, they make these changes, you're going to tell them, look, you need oxygen, you need activation, you need glucose. I mean, these are the three important things that you're going to need to make neuroplastic change. We've always just given people oxygen. As we're learning now, hyperbaric has been the next level of giving people oxygen. So from that standpoint and how I present it to my patients is I say, if we can use the hyperbaric chamber, if it's right for you, it's going to accelerate the healing process twofold, tenfold, who the heck knows. I just know it's going to be better because I'm going to force more oxygen into your body. In terms of what other conditions I do, well, I mean, I wasn't treating a lot of Crohn's patients. I wasn't treating, they may have had a concussion and they also have Crohn's,
Right.
and I've had success that way, but specifically someone coming to see me for Crohn's didn't happen. Cancer, a huge one for me, and more stroke patients, I would say, has been, from the addition to hyperbaric, has been a big asset for us.
That's great.
Yeah.
And just to be clear, I want to just clarify this, and I know this is what you mean, and I meant it when I said it the first time. With hyperbaric, it's not like we're actually treating Crohn's or
Correct.
treating cancer or treating, patients come into us with a variety of issues. In general, we're all so complex that way. And really what we're doing, especially through hyperbaric, is every cell in your body needs oxygen in order to do its job.
Correct.
And in so many cases of chronic illness, especially chronic illness, between the inflammation, some tissue damage, some vascular damage, these tissues become hypoxic. They're not getting the amount of oxygen that they
Correct.
need, so they're not functioning as well as they can. Hyperbaric has this way of delivering an abnormally high level of oxygen, which creates a surplus. And with that surplus, the body's able to utilize it to fulfill whatever healing process that it needs to go through. So by improving their oxygenation, their bodies are upregulating how well they function, and that's where healing and recovery can take place. So,
And I always say to my patients is, we all could use more oxygen. We're all terrible breathers, the air outside. So if you could increase the amount of oxygen in your body, you're just going to feel better. No matter what condition you have, you're just going to feel better.
right.
So
That's great.
thank you.
Thank you, sir. I
Okay.
appreciate that.
Pleasure.
Nice to meet Dr. Ralph, and we'll see you next time.
All right.